A partnership that can improve medication safety. Welcome back to Techstination. I'm Fred Fishkin. Joining us from GS1 is Senior VP of Customer Success, Melanie Hilton. Hi, Melanie.
Hi, thanks so much for having me, Fred.
A pleasure. So, GS1 is a global organization developing identification standards for products, a wide range, including UPC or barcodes. Do I have that right? Is that accurate?
Yes, I mean, we're most famous for the UPC barcode, but obviously we do a lot of other work in supply chain data and barcodes and RFID as on products, cases, pallets, all those things that are moving all over the world every day.
Wow. So you have a brand new partnership with Google just announced. Give us the details.
Yes, well, what we're very excited to announce that the collaboration with Google is going to result in patients and caregivers now being able to scan what's known as a GS1 data matrix barcode. So if you think of a QR code that most of us are very familiar with today, you'd scan it with your phone camera. The GS1 data matrix looks very similar to a QR code. It's the little square barcode that appears on a lot of medications. And this partnership with Google is now going to allow people to scan that with their Google camera and other apps as well to get kind of up-to-date information that can often be outdated when it appears on the paper leaflets that most commonly accompany medications.
Interesting. So this is designed to improve patient safety. Is that the main goal, or what are some of the goals here?
Yeah, I think patient safety, ensuring that you can combat counterfeit drugs, expired drugs. There's a lot of information contained in that little barcode that up to this point, patients probably weren't super aware of, even though in the pharmacy context, I think most providers and dispensers would know about it. So I think it's creating a level of transparency, but also a level of digital engagement that, you know, when you think about those paper leaflets that you get in a medication, very dense, a lot of things that can even be difficult to read unless you pull out your reading glasses and a magnifying glass. And now there's going to be a lot of ways to really drive a visually appealing and easy to understand engagement with a patient or a caregiver that will provide that up to the minute information, but also kind of segment it out based on, you know, the dosage, the use recommendations, just to make it a little bit more friendly to what specifically am I trying to learn about this medication.
So will this be used by consumers and medical professionals, both, or tell us about it?
Yes, I think both. And the one thing to keep in mind also is that this is really new. So this partnership has just been announced, and the technology was took a long time to get in place. Now the technology's there. The work will take place between GS1 and our healthcare community to ensure that we get broad adoption of it as we move forward. So if I'm a patient or a caregiver in particular, or a healthcare professional, a clinician, you might see over time that the information when you scan those GS1 data matrix barcodes, you actually get a better experience and a better experience as more of the manufacturers adopt the technology to take advantage of providing the information digitally.
So this is going to be printed on the label of the medication bottle, the prescription
Yep.
bottle.
Yep, usually on the prescription bottle, or you know, sometimes if you get a prescription in manufacturer's packaging, it's already on there. So the opportunity here is to connect what's generally already printed on medications with the digital information behind it, and that's what this Google technology unlocks. And you'll be able to do it through a native scan of that. Like if you open up your Android phone, you'll be able to do that. These updates are already being pushed to Google devices today. The Google Lens will also have this, and if you have a not Google phone or a not Android phone, there is a Google Lens app that you can download, and you'll be able to take advantage as manufacturers roll this out.
And is this for over-the-counter medications too, or are we talking specifically prescriptions?
At the moment, I would say you're primarily going to find it on prescriptions, but because it's manufacturer driven, and you think about some of the manufacturers who partnered with GS1 and Google on this effort, J&J, Pfizer, GSK, Roche, Abbott, as they do this, they're going to do it across their prescription lines and likely across any OTC lines that they have as well.
So how quickly will this all roll out and be available for consumers to make use of?
Yep. I'm guessing that now you may see some of those leaders that I just mentioned who've been part of the build and the pilot process. You may be able to find this available in the very near term. Typically, these adoption cycles can take a year or a couple of years or a longer time. You think about the UPC barcode, kind of where we started this conversation, that technology was first scanned on a pack of Wrigley's gum in 1974, but it really took us until the late 80s before we had broad adoption across all consumer products. So I think this will move much more quickly because this notion of being able to provide the patient with the most relevant up-to-date information is very important to these medicine manufacturers. So I think they're going to move very quickly. And they were really the primary drivers behind the effort to connect GS1 standards with this Google technology or with this data matrix scanning technology. So I think we're going to move a lot quicker than some of the advancements of the past.
So things like potential interactions that might be new or other kinds of warnings or just basic information, that can all be updated on the fly. So you may not have that at all, but the app might be able to tell you.
That's right, because the paper gets printed at a point in time and it may become out. You know how it is when you get a new electronic device, the first thing you do when you plug it in is you have to update it. And so this is very common as well as more information is available on the medications that we take, these manufacturers will be able to make that immediately available through these digital channels. And they're even working on, as I had kind of mentioned a little bit earlier, the ways to make it very visually easy to understand and logical. Whereas, the paper, it's just a very big piece of paper with a lot of tiny print on it. They'll be able to categorize the information so that you can kind of target as a patient or a caregiver exactly what you're looking for.
Are there other benefits beyond the obvious here?
Well, I mean, I think those ones that we've talked about are the most, but in reality, there's the convenience factor. I think the safer, smarter, and more sustainable. We didn't really talk too much about sustainability yet, but reducing
How
paper
does
is,
that figure in?
yeah, because I think eventually as you shift from printed leaflets to digital information and kind of a concept that the healthcare community is calling digital labeling, there is definitely an impact. And we've seen the studies that were done on this effort, and of course, will take a lot of time before we have full adoption, is 500,000 trees saved and 500,000 tons of CO2 reduction over time in shifting towards digital rendering of the information versus paper.
Terrific. For more information, where can everyone go?
I highly recommend that you take a look at the press release on gs1us.org, and that will link you out to some additional information about how Google and GS1 have partnered on the effort.
That's GS1, the numeral one,
Yep, US.
us.org. Melanie Hilton, thank you so much for spending time with us.
Yes, thank you, Fred. It's been wonderful.